I'm going to demonstrate the trach dressing change. We just finished suctioning and the patient is prepped and ready to go. I have a drape on the patient. I have the O2 set on the patient's finger. They are positioned where I need them to be. And to start out, I need to make sure I have the right supplies. I have a tracheostomy dressing change kit. I have hydrogen peroxide, I have saline. And then also, depending on what kit you're using, you may need to grab an extra pair of sterile gloves that will fit you. Okay, so I am going to start by getting my saline and my hydrogen peroxide ready. I'm going to go ahead and open the saline. It's been less than 24 hours, but it's already been opened, so I'm going to go ahead and lip it. I'm going to set it aside. I'm going to leave the cap off. And then I'm also going to prep my hydrogen peroxide. It's been open, but it's less than 24 hours, so I'm going to lip it. I'll leave the cap off and I'll just set it aside. I'm going to go ahead and I'm going to open my kit. Depending on what kit you're using, you may or may not have sterile gloves. This kit has sterile gloves, but I also grabbed an extra pair of sterile gloves just in case. I'm going to go ahead and I'm going to use the gloves in the kit. I'm going to go ahead and remove those first. I'm going to just set them aside. And then also on the top of my kit, I have a drape. In the event that your patient isn't already draped, you should place a drape. Anytime we're working with a trach, they can be pretty messy. And I don't need this one, I'm just going to toss it into the garbage can. I am going to now put on my sterile gloves. For most of this procedure, my dominant hand, which is my left hand, will stay sterile, and my right hand, which is my non-dominant hand, I'm going to purposely contaminate. As you practice, it might be helpful to use different colored gloves in order to keep it straight. One hand will be sterile, the other hand will be not sterile. Your dominant hand is sterile. Okay, so in my sterile glove kit, I have my gloves. They look like all of the gloves that you get when you're doing your return demonstration. They are kind of in a little jumbled mess. I'm just going to do my best with them. If I contaminate them, it's not a big deal. I'll have someone help me by getting me another pair of sterile gloves. I'm going to go ahead and put my gloves on here. Okay, and now that I have my sterile gloves on, I can touch the supplies in my sterile kit. The supplies are going to vary. You will either have several Q-tips or only a couple. You might have several 4x4 gauzes or only a couple, but you'll have a split gauze. This is the dressing. You'll have 4x4s. We're going to use these to clean. You'll have a little brush. We're also going to use this to clean. And you will have pipe cleaners and Q-tips. Now, some nurses use the pipe cleaners and some don't. You're welcome to use them if you would like. And then we are going to have the dressing, the tracheostomy dressing tie, so trach ties. This is called twill tape. A lot of patients who are at home with long-term trachs use twill tape. You might see a Velcro tie in the hospital. If you have a Velcro tie, we would just take that off and replace it with a brand new one. Okay, and now I am going to get my tray set up. In one of the chambers on my tray, I am going to pour saline. It is going to be saline by itself. So we're going to go ahead and we're going to pour some saline. And then I'm going to go ahead and take my saline. I'm also going to pour it into another chamber. I'm going to choose the bigger chamber because I'm going to use that one to clean with. Okay, and in the cleaning chamber, I'm going to take my hydrogen peroxide and I want to pour the same amount of hydrogen peroxide as I did with the saline. So it's going to be half and half. Okay, and I'm just going to set those aside. We're done with those. And then I'm going to turn and I'm going to get my patient ready. So things I should do, I have an O2 set on my patient's finger and I'm watching my patient's oxygenation status the entire time. This hand will now be purposely contaminated. I'm going to remove the oxygen tubing. I'm just going to set it aside. I am going to remove the trach, the old dressing, and I'm just going to go ahead and toss that in the garbage. And I'm going to loosen and take out this inner cannula. I'm going to take the inner cannula and I'm just going to set it. I'm not going to let it fall in the chamber, in the basin, but I'm going to go ahead and just set it so that it'll kind of lean there on the side. Well, in theory. Okay, and now I am going to clean around the stoma. I am going to take one of my Q-tips with my sterile glove, and I am going to dip it into the saline. I don't want to use the saline and the hydrogen peroxide for cleaning around the stoma because hydrogen peroxide can damage the tissue. I'm going to go ahead and just use one Q-tip per swipe. I'm going to just do a nice little swipe around the stoma. I'm going to get rid of that Q-tip. I'm going to take the other Q-tip. I'm going to dip it into the saline. And I'm going to do the same thing around the top of the stoma. Okay? Just a little half circle there right around the stoma. And then I'm going to take one of my 4x4 gauzes. I'm going to dip it into the saline. I'm going to fold it though before I do it. I'm just going to fold it into a little square. Actually, I probably shouldn't have touched it, right? So, without touching it, I'm going to fold it into the little square. I'm going to dip it into my saline. And I'm going to swipe down each side of the faceplate. This little piece right here around the inner cannula is the faceplate. We're just going to do, I'm going to use this contaminated hand to move that, and we're going to do one little swipe. I'm going to turn it, and I'm going to do another little swipe. With the saline, I'm going to get rid of that. I'm going to go ahead and with my sterile hand, I'm going to keep it sterile. I'm going to fold this into a little square. I'm going to just do a quick little drying around the stoma with it. I'm going to go ahead and turn it. I'm going to dry around the stoma. I'll go ahead and toss it. And I'm going to take the other little 4x4 square. I'll fold it into a square again. And I'm just going to wipe down the front of the faceplate. I'll go down one side, turn it, and go down the other side. Okay. I am now going to take the split gauze dressing. This is where your pipe cleaner might come in handy. If you have a tracheostomy that fits very tightly, you might need to use this to just sneak it up and around the stoma, but I'm going to go ahead and sneak my split gauze dressing up around the stoma. And I'm going to use my sterile glove. At this point, I'm not sterile, you guys. I'm going to use my sterile glove for the piece that's around that stoma. Okay, and now I'm going to clean the inner cannula, just sitting right here. I'm going to go ahead and grab the outside part of it. I'm going to grab it with my right hand, which is my non-dominant hand, this piece. Then I'm going to grab my brush. We're sitting in the hydrogen peroxide and the saline here. I'm going to put the brush through from the top down and get rid of the dried secretions. And then I'm going to rinse it into the saline. I'm going to scoop the water through from the bottom up to the top, and I'm going to tap it dry, and then I'm going to go ahead and replace it. Some of these you have to turn to tighten. Some of them have a little piece on them where you squeeze. Go ahead and squeeze it into place. Okay, and now I am going to replace the tracheostomy ties. If you're in the hospital, chances are good that you'll see a Velcro strap, and your patient will have Velcro strap. You will just replace the Velcro strap with a new one. If you are working with twill tape, then you'll replace the twill tape that's in place with a new one. A general rule of thumb, and for safety, is to leave the old twill tape in place, or the tracheostomy tie in place, place the new one, and then you can take the old one off. We want to make sure that the tracheostomy plate is stable and secure. Okay, so I am looking at my twill tape. I am going to go ahead and I'm going to feed one end of it through the faceplate, and you'll see right here that this is where the old one is. I'm just going to go ahead and feed it through, and we're going to do just basically the same thing This is going to match up. I want to make sure that the ends match up. And then I'm going to, if my patient can lift their head, I'm going to have the patient lift their head. I might need to ask someone to help me lift the patient's head, but I'm going to go ahead and I'm going to gently sneak this around. And my patient's SATs have been good. Make sure you're watching your patient's SATs as you do this. For safety and to prevent skin breakdown, I want to make sure that I can sneak 2 fingers underneath those trach ties. I'm going to take both edges here and I'm just going to feed them right up through the face plate. Okay, and then I am going to use a square knot. I'm going to just tie that in place. And a square knot is similar to that quick release knot that we teach you when you tie restraints. Okay, and I'm going to double check for placement. I can fit 2 fingers. I've got the old tie, and you know what? I'm going to go ahead and just remove the old tie. I'm going to sneak that around. Patient's still doing well. I'm watching his SATs this whole time. If his SATs were dropping, then I would go ahead and I would replace the oxygen. We'd take a little break. Okay, now I would just grab some scissors and clip those. Okay, so there you have the basics of a dressing change. Things to document. You would want to document that you used sterile technique. You followed the facility policy. Some facilities use hydrogen peroxide, some don't. You want to document what the stoma site looks like, how the patient tolerated the procedure, and then for safety you would always want to listen to their lungs again, and you'd want to double check their O2 sats so you can chart that. And that is it for trach dressing change.